Is pot good for your orgasm? Hi, I'm Dr. Marianne Brandon, and I'm here with my husband.
Hi, I'm Dr. Abraham Morgentaler, and we are the Sex Doctors.
And we are here today to talk about a very important topic, a woman's orgasm.
Nothing could be more important.
You know, I have to agree with that. And it's a common concern for so many women.
Right, because a lot of women have trouble reaching an orgasm.
That's right.
And a lot of the guys, by the way, are thinking that they're not doing it right if they can't help the woman get there.
So orgasm for women can be tricky, for sure. That's like the topic of probably another podcast.
Right.
But these authors put out a great article about pot and orgasm for women that I think could be helpful information for a lot of our listeners.
Oh my God, pot and female orgasm made into the sexual literature.
Yes.
Oh my God,
let's hear. Kind of a match made in heaven.
Let's hear what they do, what they find.
Let's say shout out to the authors Mulville and Tischler this year in Sexual Medicine, and basically they wanted to explore the impact of pot on women's orgasm.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Welcome to the Sex Doctors, featuring Dr. Marianne Brandon, clinical psychologist and diplomate in sex therapy, and Dr. Abraham Morgentaler, renowned urologist and expert in sexual medicine and testosterone therapy. Together, they bring you expert insights into sex, intimacy, and relationships. Let's dive in.
I believe in miracles. Where from?
So they wanted to know about like frequency and intensity and all this kind of thing.
Yeah.
So they asked women who had used pot to fill out a survey, and most of the women were under age 30. Well, all of the women I think were under age 34. They were between like age 25 and 34. So that's like prime orgasm age from a hormonal perspective.
One would think so.
Yeah. And nonetheless, they had these difficulties, which, as I've said, I hear so often from women in my practice.
Right. So what was the study? What did they do?
So basically, they asked women their assessment of what sex and orgasm was like without pot and with pot, and they just amassed the data. So now keep in mind that these women were used to getting high or eating their edible, whatever it was they were doing. So it's a different group than women who had never tried pot, but that doesn't mean this isn't a good idea for all women. It just means in this study, that's what they looked at, people who are already kind of comfortable with it. And they found overwhelming numbers of positive support for how pot can help a woman have an orgasm in terms of intensity and frequency and ease. So it was like off the charts in terms of positive feedback from women about it.
Yeah. Isn't that cool?
Yeah.
So I'll tell you what I liked about the study. So this study, so this is not like a randomized controlled trial. It's a survey study, right? So this isn't where they said, okay, we're now, you get a baseline set of responses and then you give an intervention like, okay, take pot now and then try and have sex. So these were asking women who were partnered and who were sexually active within the last 30 days to respond to a questionnaire about their orgasmic ability or inability with and without cannabis. Right? And they used there's the best validated instrument, or the most commonly used validated questionnaire, is called the FSFI, which is the Female Sexual Function Index, and there's a subgroup of questions that relates to orgasm for the women. Yeah, and so that's really what they were focused on. And people answered questions. You had to sort of grade the degree of which you had a problem. So they'd ask something like orgasm frequency. Potential answers range from almost always to always, like how often they had it with intercourse, to almost never or never. So those are sorts of the ranges of things that they answered. And to me, one of the most impressive results, if I can find it here in the paper, was that 34%, so a third of the women, reported that it was not difficult to orgasm with cannabis and difficult to orgasm without it. That's huge.
That's huge. That she has difficulty on her own, but with pot, not a problem.
Right. On her own with her partner. In other words, on her own without the pot. And that the orgasm frequency increased by 40%. That's pretty good. That's pretty good,
There's
too.
some happy women out there.
Yeah.
Yeah.
So, what strikes me is that we know each other for a little while.
We have.
Yeah, we have discussions about sexuality. And I know that you've told me that you often recommend to women who are having difficulty that they take pot.
Yeah, I do. And I've even said to women on multiple occasions, you can see me like weekly or every other week for this year, or you can go get high. Because pot can change, it gets women it gets people out of their heads, kind of embodied in a way that they can tune into sensation more. Plus it amps up sexual sensation or sensual kinds of sensation.
Yeah.
So that combination is just really magic for a lot of folks.
Yeah.
So I do prescribe it. And it's funny, I will often ask a woman before, if I'm working with a couple, I'll ask her first, would you be willing to get high? Would you be willing to try it? Most women, by the time they're in a sex therapist's office with a sexual concern, they'll try just about anything. So most of them say, yeah, okay, but I often hear in a heterosexual couple, yeah, I tried it. My husband, he can't stand pot. He would never, ever go for it. So I'll say, well, can you let me just float this out at least? Can you let me try?
Right.
So yes, they'll say yes. And most of the time, the guy's like, sure, if she's willing.
Even the guys who may not think that highly of pot as a
absolutely.
recreational
When people realize that it actually can be helpful for their sex lives, yes, absolutely, people take it really seriously and they're willing. So I've seen so many shocked women over the years when the guys are willing.
That's a cool observation.
Yeah, it is pretty cool. Yeah. And so I also make sure to talk to people about if they've never been high before. You want to kind of start slow. You're not looking to get yourself blitzed. You're looking to really just kind of get yourself open, get your body receptive, get tuned into your sensations.
Yeah.
You don't have to be fully high. You might decide you like that, but I wouldn't encourage someone to just go straight in for a full, what people would consider a normal dose of pot. I would have them go slowly and see what it feels like to be more in their bodies. And so take their time. There's no rush. Just go slow and see what works.
I would imagine if somebody is stoned out of their gourd, that maybe it wouldn't work so well.
I think it would interfere. So they might still have a great orgasm, but they might be so zoned out that it just doesn't have the power to the experience that. I mean, I think everybody's different. But
what do you recommend to the guys? Should the guy, if the female partner is going to get high, should the guys get high?
That's really up to them. But what I often recommend is that they do this first without sex. If she truly has never been high before, she probably has some reservations about it. And so I have her start super slow. Try just getting high and hanging out and watching a movie together and see how that goes. And then I would have her masturbate on her own. If she's willing to have her partner there, great. But if not, if she just really wants to try it on her own in privacy, absolutely. Then have her get high and masturbate, see what that's like. So work her way into it. I'm not a fan of throwing people into situations they're really kind of a little bit anxious about. So that's what I would recommend.
That sounds like a smart approach to me.
Yeah, so if what I say to him to get high, I would say let's let her get used to it first, and then you guys decide if you want to do that or not. That's what I would say.
Yeah. So, one of the things that interested me, that I really learned something here is, the question is why does cannabis, why might it be helpful in this way? Mm-hmm. So, I think that probably, on sort of a broad observational basis, we could say, well, people become more sensitive, right? Sensitive to touch and embodied, if you will. Mm-hmm. That's a word that I learned from you around all these things, but it's perfect.
Yeah.
Sensations are enhanced, right? That's why often people take pot or use pot. But one thing that I hadn't appreciated until I read the discussion in this article is that, first of all, there's a big group of women who have difficulty with orgasm because of a history of sexual abuse.
Yes.
Or I don't want to say that it's caused by it, but it's certainly associated with it, and PTSD. And that THC, the active ingredient in cannabis, works on the amygdala and the hippocampus in the brain, both of which are related to sort of rules and restrictive kind of feelings, right? And so there's, as they say, THC in cannabis reduces activity in the hippocampus and amygdala, the parts of the brain that store and react to traumatic memories.
Wow.
And that this activity may play a role in extinguishing traumatic memories and result in a more positive orgasmic response.
Isn't that awesome?
Yeah, isn't that interesting?
That's fabulous.
So there may be something even at a brain level
Right.
that goes beyond what you and I might sort of imagine on our own that might be happening. Very interesting.
You know what I would love to see a study on is there any role for pot with folks who have SSRI-induced sexual dysfunction? And I don't think I've ever seen anything like that. But I have suggested to some of my clients over the years who are struggling, they're taking an antidepressant that interferes with their libido or their arousal. Try pot, see if it helps. But I don't recall that anyone has given me feedback about it.
Yeah.
But it would be an interesting study, wouldn't it?
Yeah, great idea. You know, the other thought we have is, you know, in some states, marijuana can be legal, but only for medical indications.
Yeah.
So this seems to me like a perfect medical indication.
Absolutely. So we've lived in a state like that before, and I referred many of my clients to a physician that did medical marijuana prescriptions, and that was so great for them. So yeah, he was totally about working with people with low libido or arousal issues, like everybody, you know, any gender, whatever. He was into it in terms of being helpful. And yeah, absolutely, it's a medical
Well, there
issue.
you go. Medical indication
Yeah.
for cannabis.
As prescribed by the sex doctors.
Yeah. Well, we're not writing any prescriptions for it. But
We are concerned about their orgasms. We want to make sure.
we're so concerned.
you know,
We really we want those orgasms for people.
Yeah.
Absolutely.
So we're going to do what we can to get through all of the literature and tell you
We're pro-orgasm.
what can be helpful.
Yeah, we're pro-orgasm.
We
Wouldn't you
really
say?
are. I would say we are.
Yeah.
Yes.
Well, I think that wraps up this session.
I think so too.
So, if you like this content, we certainly do, but we would probably be having these conversations even if we weren't listening. But if you like this content, give us a thumbs up, write us a positive review, and please subscribe so you know
Please do.
when our stuff is coming out. And we hope to see you again on another podcast of The Sex Doctors.
See you soon.
Thank you for listening to The Sex Doctors with Dr. Marianne Brandon and Dr. Abraham Morgentaler. Be sure to subscribe, leave a review, and tune in next time for more expert advice on sexual health and relationships.
I believe in miracles. Where you from? You sexy thing, you. I believe in miracles. Since you came along.